increase the life expectancy, advancements and a breakthrough in the field of diagnostics, therapeutics, and preventive medicine. To overcome the challenges in each and every step in clinical research, the cooperation among a diverse group of stakeholders like clinical investigators, patients, physicians, and regulators is necessary in conducting a clinical trial study. And the objectives of this conference is, this conference is majorly aims to build up the interest and to gain the knowledge in both pharmaceutical and clinical research, where we can come out to the innovative ideas and to share these ideas at one platform in order to build up the healthy India. It makes a platform for interaction between the academicians from university and the institutions and scientists from R&D centers and managers from pharmaceutical industries. And students from various colleges to exchange their views as well as ideas too. This conference also provides a bench for budding pharmacists, business scholars, and teachers to present their talents in the form of the research as well as review papers. Totally 650 delegates from 7 different states are participating in this seminar, and among them 350 delegates are presenting their papers. The guests of today's function will give 6 plenary lectures, and all the delegates will get academic benefit in their lectures. On behalf of our college, I would like to take this opportunity to express my sincere thanks and wholehearted thanks to our Honorable Chief Guest, Dr. S.V.M. Prasad Garu, and members of the management and resource persons and evaluators and OPM members for their immense presence in this inaugural function. And I also thank all the delegates who came from various places to attend this conference. And I thank the principals of various pharmacy colleges for their support for sending their students as well as the faculty members. And I also thank all the delegates who are attending this function. I especially thank the print and electronic media for their wide coverage. I wish all these particular 2 days of the interesting and beneficial program, and also that we have a pleasant stay in our college. And I especially thank and also congratulating the persons who are going to receive the Operant Pharmacy Federation Annual Awards 2018 also. And I wish all the best. And finally, thank you and all.
I request Dr. Sneha Arambani, Professor and Head, Department of Pharmacology, AIMS, Jodhpur, Rajasthan, to speak few words on this occasion.
This institute, all the dignitary on the dais, faculty of this college, students. I wish this conference will be a grand success, and I appreciate all the efforts made by this OPF, this Operant Pharmacy Foundation. So I wish you all the best to all. Thank you.
I invite Dr. D.S.R. CHMP Varma, Assistant General Manager, RAKM Pharma Limited, Hyderabad, to share his views.
Once I left the college, many times I have attended the technical seminar. This is my first conference speaking to the students. The house is completely full, and all the students' faces are bright, full, eagerly seeing about the coming technical sessions. So I promise you, every speaker and the delegate will give you enormous knowledge which you will carry while moving towards your home, and which can shape your bright futures. That today in India, apart from software, the next technical course, the pharmacy, will rule India for many more years, because as said by the Operant Pharmacy Federation, our colleague, that pharmacy in India is growing enormously day by day. The industrial presence as well as the academic presence is going on. There we can see many of our international speakers who are working across the globe in many of the universities, and every year they are attending many technical seminars and carrying on a valuable information, and that all valuable information will be shared to you. And be proud that you are going to become the future pharmacist for India, and assured with your enormous knowledge which you gain from your academics, you will bring a few more molecules. Already many molecules of cancer have been launched in the market, and next phase of biosimilars which are going to be launched in the market are going to give an immense support and service to the nation by supplying the new drugs and moieties. So in this, the theme of our pharmacy is the challenges about the clinical trials. I will little bit cover a few in my technical session about the clinical challenges and how many opportunities are there waiting, and the industry is waiting for you guys. Please be positive and keep watching on the program. Stay tuned. Thank you very much.
It is my privilege to invite Dr. Thakur Kurjit Singh, Associate Professor, Department of Pharmacology, Chitkara College of Pharmacy, Chitkara University, to speak few more service quotations.
Good morning all. I'm happy to, first of all, I want to congratulate on all of you on International Pharmacist Day. On the behalf of OPF and BV Institute of Pharmaceutical Center, I want to congratulate the team of organizing, secretary organizing team of both the OPF and BV Institute of Pharmaceutical Sciences to organizing such a awesome international conference at this level. And best of luck for your future. Thank you.
Dr. S. Ramakrishna, Principal Scientist, Pharmacology Division, Institute of Chemical Technology, Hyderabad, Telangana, to share his views.
Dignitaries on the dais, and the chief guest of today's function, Sri Prasad Garu, and my fellow speakers, and dignitaries on the dais, and my dear students. Good morning to all. I am not getting any voice, raising voice. Good morning. That's great. Okay, happy Pharmacist Day. I'm glad that I am one of the pharmacy fraternity. I did my pharmacy from Andhra University. I graduation and post-graduation. Well, debating on the future of pharmacy and the prospects of pharmacy, those is not a platform. Let us all cherish the moment that pharmacists play a major role in the health of the government health in the country. That's more important duty they are doing. Of course, there may be some hiccups to reach up to a particular level, but pharmacists play a lot of role, major role they play. Another thing what we see is that this is the only area, subject area, pharmacy, which will cover almost all the facets of a science. Just recall what we have studied in B.Pharm levels. You will do engineering, you do mathematics, you do maybe biology, you do pharmacology, pharmacy and medical graduates, you do similar things. They are jack of everything. And this is the unique feature of this particular course. And this particular course, the knowledge of pharmacy, will be essential in certain areas. Because I am from a research institute, I confidently can say that in the area of drug discovery, the area of drug development, the pharmaceutical sciences, persons with the pharmaceutical sciences background play a major, key and important role in this particular process. I'm glad that Lakshman Rao has organized a conference on association, and I wish this particular entire 2 days program a great success. And you can listen to these people, including myself, and all the speakers over there, and let us share what we are doing and what the other speakers are telling, and make use of the opportunity, particularly the experts who are in the B.Pharm family here and M.Pharm. Please pay a lot of attention to the lectures that are being given by the speakers. They are useful, no doubt. We hope that we will stimulate interest in you in the area of the pharmaceutical sciences. I wish the conference a great success. Thank you very much.
I deem it a great privilege to invite Dr. V. Gopal Professor and Principal, College of Pharmacy, Registered Academic, Mother Teresa Postgraduate, Research Institute of Health Sciences, Indira Nagar, Puducherry to come to share his views.
Happy morning to one and all. There was a small discussion between a hammer and the key. The hammer told to the key, we both are capable of opening any lock. But I, the hammer, I will have to hit and break open a lock. But you, the key, you are able to open it very easily. How is that? The key replied, you, the hammer, you are hitting on the head. That is why it is very difficult. You are breaking the head. But I, the key, I am touching the heart. That is why it is very easy. We have here on stage a person who has touched the hearts of all the people who are here. It is none other than SVUM Prasad sir, who is basically a chief guest on the stage. Thank you very much, sir, for raising this beautiful occasion. There was again a small discussion between the matchstick and the matchbox. The matchbox, as per the matchstick, we both are rubbing against each other. But every time we rub, I the matchstick, I am getting burnt. But you the matchbox, you are not getting burnt. Why? The matchbox replied, you the matchstick, you are having weight on your head. You are having head weight. That is why you are getting burnt. I the matchbox, I am not having head weight. That is why I am not getting burnt. A person without any head weight, but a very active person, this entire national conference is his baby. It is none other than the principal of this prestigious institution. I am very happy, and on behalf of the entire gathering, I congratulate the dynamic principal. Last week, I happened to go to a tailor shop. On the table of the tailor, there was a very beautiful scissors. By nature, I just took the scissors and I was just cutting some piece of cloth. The tailor became very angry. He snatched the scissors from me and said, this is a very costly scissors. It costs 5,000 rupees. Then, with the help of that scissors, he cut the cloth in front of him. After using that scissors, he threw the scissors on the floor. He was wearing a turban, and in that turban, he had a small needle. With that needle, he made some stitches. And then he again placed that needle in his turban. I asked him, sir, what is the logic? You are saying that scissors is 5,000 rupees worth. You are putting it on the floor. And this needle is not even worth 1 rupee. You are keeping it on your turban, close to your head. What is the logic? He said, scissors is used for dividing. That is why I put it on my foot. But needle is used for joining together. That is why I put it on my turban. Today, one family has come here to unite all of us. It is nothing but the founder and the members of OPF who have come here and who have made this program a mega success, who have taken this conference to national level, to international level. So I congratulate the founder and his entire family members for their active involvement in this beautiful conference. My fellow speakers from various fields, the principals of the various pharmacy colleges in and around this beautiful place, faculty members of this prestigious institution, members from the print and media, and my dear, cute, intelligent, ever-smiling, bright students. This is admission time. So 3 months back, one father brought his son to me. Sir, please give him career counseling. He was a very naughty boy. He was not quiet even for a minute. He was just taking this, taking that. So I called him and then I asked him, what is your passion? He said, sir, I love computers. I have done a course on hacking. I can hack anything. I can hack your cell phone. I can hack your laptop. Then I said, you stand 2 feet away. Then I asked him, why do you like hacking? Sir, I want to fight. I'm a born fighter. So every time I hack, I have to fight with the person who is using the cell phone, the person who has created the password, the person who has done the security management. So I like to fight. I am a born fighter. Now let me know, what course should I take? Then I told him, you immediately join pharmacy. He said, why should I join pharmacy? Because you are a born fighter. You are born not to fight with ordinary people, with a laptop, with computer. You are born to fight with God. Every day, God will introduce a new disease. You will have to hack his program and find a medicine for it. You fight directly with God. So immediately he agreed and he has joined the B.Pharm first year in my college. So, my dear friends, today is a very important day in the life of each and everyone who have come here. World Pharmacist Day. In some college, they are having a rally today. In some college, they are having essay writing competition, elocution competition, culturals. In some other college, they are having some health camp. But in the whole India, this is the only college to celebrate World Pharmacist Day by organizing an international conference. I congratulate the entire organizing team for this beautiful thought, and this has created history. So congratulations to each and every one of you who are here. My dear friends, when you go to a small function, you make a small decision. When you come to a large function, you make a major decision. So in this big function, major function, I request you to make 2 major decisions. Number 1, if we want to survive, we should adopt, encourage and follow the system of family pharmacist. The pharmacy profession is popular in 2 places. One is the Great Britain, another one is Australia. In both the places, it is popular because of this concept. I think some 40 years back, if you ask your fathers, forefathers, they will be able to know and they will be able to explain to you, there was a concept of family doctor. Each and every family had a doctor. So whatever problems they have in that family, they say to the doctor. Now doctors are scarce. We don't have sufficient number of doctors, and doctors are over-occupied. They are very busy. Now it is the time to take up the concept of family pharmacist. You are an authority on medicine. You are the makers and messengers of medicine. You should adopt families, and that family, for all their health concerns, they should come to you, the pharmacist, who is a vital member of the healthcare team. Will you do that? Thank you. A doctor has a suffix, capital D and small r. We call him doctor. An engineer has a suffix. We call him with capital E and small r, engineer. Even a physiotherapist, they have it as capital P and small t. But where is the identity for a pharmacist. So we should make up a resolution, we should pass it, we should make it as a legal term, and we should have a suffix, capital P and small h. So when we have a suffix in front of our name, we will be identified. When you take up a flight ticket, if you put doctor, they ask you, are you doctorate or doctor? If you are doctorate, please don't put it as capital E and capital R. Because in case of an emergency, we need a doctor. So everywhere, identity of the profession is very important. So I propose in this August gathering to come up with a concept of having a prefix, that capital P and capital H in front of all the pharmacists, so that we will be identified by our profession. Do you agree? Yes. Thank you very much. In Tamil Nadu, we have a group of chain restaurants. For various reasons, I can't give you the name of that restaurant.